Jimmy, are you with us?
Yeah, can you hear me?
You bet,
There
sir.
we go. How you doing tonight?
Great, great. How's everybody else?
All right,
Hopefully
so I
well.
believe what we're going to do is we're going to go over just the whole MitoPrime. And I'm not for sure, but I think the people who are listening in, you can kind of type in some questions that you might have about it. I'm going to approach it just from a personal training or a fitness perspective, to whereas John is going to go a little bit more into the science behind it. And while we are so excited that we are on the forefront of launching this unbelievable product. So with that, I'm just going to get in. I'm just going to ask John some questions about the product, and hopefully he can answer from his own research and from his own experience. How does that sound, John?
Yep, sounds good. Sounds good. Fire away.
All right, so we're gonna get right into it. So my first question to you is, John, is what is MitoPrime?
All right. Well, well, first of all, let me just say there's a ton of information on on this product. I could very easily talk for a couple of hours. I won't do that tonight. We're going to try to give you guys all some basic information uh, that is hopefully something that you guys are able to talk about a little more intelligently and maybe pass on to some folks. But MitoPrime is a fairly new product on in the market space, created from a company called NNB. NNB is a company that basically brings and makes ingredients and puts them in the marketplace. They're actually located north of Dallas or close to Dallas. But MitoPrime is basically it's a naturally occurring amino acid that exists out there, and the scientific name for MitoPrime is called ergothionine, ERGO thionine. And what NNB did, they have a very patented process. It's a fermentation process where they can take this ingredient and extract it, but the raw ingredient itself is extremely expensive to extract. This ingredient is found in its most purest form and in its highest content, and believe it or not, mushrooms. So this is a plant-based amino acid. And what they've done over the course of several years now, the research on this particular ingredient, it has been shown to be extremely, extremely powerful for all of the cells in our body. It has so many different benefits, which is why, guys, the fact that we have our hands on this product is amazing. No other, certainly no other MLM company, no other nutraceutical company has very good access to this product. We basically own this with You Are Worth It. So this fell into Chris's hands, and you guys, I hope you get some good information from what we're about to go over. Um, but let me just kind of start. I'm looking at some notes here because I dug up quite a bit of information here. NNB, when they patented this fermentation process, they patented what's called an isomer version. An isomer is basically another form of the original product. It's like thinking about your right hand versus your left hand. An isomer is like the left hand. It's a mirror image of the right hand, but it's still the same product. Your body recognizes it as the same thing, but they're able to do this in such a way that they can make it affordably extractable. So it makes it a little more affordable to produce under mass production ability. So hopefully that kind of answers that question about what it is. But I don't know if you want me to go ahead and go into other aspects of this, or stop and pause and let you guys take some notes or jot some things down. But did that kind of answer the question of what it is?
Yeah, I think so, and I think the line of questions I have, you'll be able to explain a little bit more.
Sure.
So I think someone asked in the comments, this flashed across my screen. I'm not good at Zoom, people. I don't know how to navigate it that well, but I see a little comment flash across, and it was talking about mushrooms. From your research, has there been any adverse side effects that you have come across if someone had allergies or allergic to mushrooms? in the data that you have researched?
Great question. So because this is a naturally occurring amino acid that was, discovered a few years ago, I there's been no known adverse effects of people consuming this product. If somebody happens to be, sensitive to mushrooms, I don't think I've ever met anybody that's allergic to mushrooms, but they might be allergic to the actual mushroom or the ingredient. Mushroom is a fungus, really, so it's a fungi. So somebody may be sensitive to that. Their GI tract may be sensitive to that, but not the actual amino acid ergothioneine. Again, it's a naturally occurring element, and to our knowledge in the research, there is no adverse reaction to this. In fact, if you look at the information about that, it's 100% natural, it's 100% vegan, it's 100% gluten free, 100% allergen free, 100% lactose free, 100% toxin free, 100% hormone free. It's a non-GMO certified product, which means it has not been genetically modified. Something interesting about GMO products, and not a lot of people will realize this, but a GMO product, if it's been genetically modified, our gut lining doesn't recognize this. It recognizes it as a foreign substance, and that's why a lot of people are sensitive to genetically modified products. So this is non-GMO. It's GMP certified, which means it's good manufacturing processes. It's ISO certified. It's NSF certified. There's no soy, no dairy, no corn, no nuts, no sugar, no caffeine, no animal parts, no shellfish, no artificial flavorings, no artificial colors. So this is about as raw and pure as you can get. So no, I don't anticipate any sensitivities, any reaction to this whatsoever.
Good, good. That's good to hear. I guess my next question will be to you is, in your research, um, what are some of the benefits that you have come across in taking this product?
Oh my gosh. Okay, where do I start? All right, this is where I could talk forever about this product. I was talking to Chris when he first introduced me to this. Chris kind of hit on it a little bit because I, am in the wellness industry. I have my own wellness clinic. I'm constantly looking for that, holy grail of nutraceuticals. And there are a lot of great products out there, a lot of great ingredients out there, but you have to reach for several different ones to do a variety of things depending on what it is that you're looking for. But I've never seen one ingredient that does all of these things. I mean, it's mind blowing what this can do. So I'm just going to kind of run down a list because there's a number of things that this does for us. It combats oxidative stress. Okay, oxidative processes are what kind of create cellular damage, and then that cellular damage is what ends up turning into other disease processes. It protects our DNA and our genome material. It protects our mitochondria inside of our cells. Mitochondria are small organelles inside of our cells that produce our energy or produce ATP. So it helps protect that. It increases our energy and stamina through the same processes. It reduces cellular inflammation. And I'm going to come back to that one because that one's huge. It boosts our immune response. It helps our innate immune system and our adaptive immune system. It detoxifies our cells, and it protects our skin through similar processes. In fact, it protects us against UV rays. But let me touch a little bit on the cellular inflammation. One thing that most people aren't even aware of is about 90 to 95% of every disease processes starts with inflammation. If you think about all the disease processes that we're all familiar with, you think about arthritis, bursitis, cellulitis, dermatitis, esophagitis, and the list goes on. All of those words end in itis. And itis, translated in Latin, means inflammation. Okay, so if you've got a product that's going to reduce or eliminate inflammation, you've got a product that's going to slow down a disease process, or even in some cases, eliminate a disease process. So that is probably, to me, the absolute hugest thing about MitoPrime. And that's why we all really need to get excited about this product.
It's good. And I can tell you from my own experience, I forgot to mention this earlier. I'm a personal trainer. I've been training people for over 10 years now. And as a trainer, you know, you have such relationships with your clients. And when they come to you, mainly to build muscle or to lose weight, they take your recommendations as Bible, right? So, you know, we are very careful as trainers to what we recommend for our clients to take, right? Because we recommend something that doesn't align up with the client, you know, it is bad business, right? So we really look into the products that we're going to be recommending to our clients. And from my research and researching this, I was blown away. I'm talking about utterly blown away about some of the research that has been done about this product. And the consensus that I have found was the only bad thing about this product was that it was very expensive to make.
That's right.
Right. And so with that, like John said before, NMB has come in with proprietary rights to their process. They was able to mass produce the same exact ingredient as ergothioneine at a in mass, which allows us to be able to be the forerunners to push this out into the market, right? Someone mentioned in the comments about competitors. Well, when I in my research of doing this, you can find ergothioneine for about a 30-day supply for $90 with only 5 milligrams. To whereas in our product, correct me if I'm wrong, in our vitamin drink alone, we have 30 milligrams, right? 6 times as much in our products than what you can find in the open market. And when you do your research, you'll find also too as well, for just 10 milligrams of the pure extract of this stuff costs $100, right? So if you do the math, you see why a lot of companies out there do not offer this. So thinking of it from the perspective, you know, you have this super drug or this super ingredient naturally occurring that you will be the first ones to be able to push out to your families and friends. I mean, this stuff, as someone who had diabetes at one point, I understand the mental anguish you go through looking for anything natural to help you overcome it. And the research shows, early research shows that this can have a positive effect on those who suffer from type 2 diabetes. I deal with a lot of those clients on a daily basis. So, you know, for me as a trainer, having a product such as this that's going to help aid in my clients' overall health, it's a win-win for me. You know, I'm definitely looking forward to actually getting my hands on this and taking it for myself. Anything else you want to add to that, John?
No, those are all very good points. The cost basis for this is a very huge benefit to us to be able to push out the way we do it. You know, I I deal with a lot of products here. Some of the, you know, I deal in peptide therapy as well. And, you know, for example, one of the peptides that I deal with that I recommend for weight loss for some of my patients, my cost on the product is $350 for a 30-day supply. So without it marking it up at all, you know, you're looking at $350 just for me to get the product here to my clinic. So, you know, this product to me is very affordable for what it will do for people. And the more research that I look into, you're going to see this. You're going to see L-ergothioneine or ergothioneine. You're going to see a lot of new information coming out about that. But guys, we basically own it. So everyone who's looking for this is going to be coming to us for it, in my personal opinion. There's a couple of questions on here that were thrown up. Belinda was asking, what other ingredients are included in the composition with the MitoPrime to make up our products? That might be a Chris Atkinson question. I'm not privy to the other ingredients yet. They were still finalizing all that to my knowledge, but maybe Chris can chime in here in a moment. One of the other questions was, do you think it can help fibromyalgia? Fibromyalgia is a very unique type of pain syndrome. Most of that involves inflammation. So I would venture to say, heck yeah, if I had fibromyalgia or any of my family members had it, it's certainly one of the things that I would recommend for them to try. So hopefully that answers your question, but there's a lot of information that we're going to be learning along the way. We cannot make claims that this cures or diminishes or eliminates any disease process. We got to be extremely careful about that. But what we can say is, we can share our testimonials and we can share our stories of what that product has done for that particular individual. So just want to throw that out there as well. We got to be careful of how we frame this information in terms of people with different disease processes and what it could do for them. So, guys, just be mindful of that and be careful about that when you're talking about people. You can't say this cures fibromyalgia. You can't say this cures diabetes. But what we can share is that, my glucose levels went from sky high to manageable. I mean, that's what it did for me. So we have to be cognizant of just simply sharing our testimonial and not making any claims. So
I had another question for you, John, real quick. As far as in your research, how long does it stay in your system?
Oh, great question. Yeah. So if this, would come and go in a day and it'd been gone, that'd be one thing. But the research points to this product actually lasts about 30 days in our system. So, there's good things and bad things about that, right? It's bad because it does go away and it means we have to take it again. But it's good if we're the ones that have access to this product, which means we're going to have repetitive, loyal customers. And if anybody, paid attention to that, residual pay on the comp plan, and you've got to get those 4 customers, chances are you're going to hang on to those 4 customers pretty easily. So that's the information that I found. About 30 days is about how long that lasts.
Okay. And then in your research, I know I came across something that talks about like aging or longevity when with the ergothioneine. Do you have any research or can talk about that, or
Well, the
is that what?
most, yeah, I do actually. The thing that ages us the most, or yeah, the thing that ages us the most is oxidative processes or damage to cells. We always hear these things about free radicals and all of that thing. And so ergothioneine, one of the most powerful things that it does is it helps reduce oxidative processes and oxidative stress on all of our cells. And so if you can reduce that oxidative process and that damage to your cells, you're going to increase your longevity. So there's a lot of articles that I've seen too that kind of dub this as the longevity vitamin. You're going to hear that again. You're going to see that again. You're going to see that in the literature. I like to, when I talk about wellness, I like to talk about, adding years to your life, right? But what's more important than adding years to your life is adding life to those years. And so I'm very confident that a product like this and all of the things it is able to help us with, you're going to have a quality longer life, not just a longer life. I don't want to be, stuck in bed or in a wheelchair when I'm 85 years old. I like to be out there enjoying life. And I think this is truly something that can do that.
It's good. Someone asked a comment as far as cancer goes. Will it help with cancer, with cells, or anything as far as those types of diseases or illnesses, anything?
Absolutely. It can reduce the risk of cancers. But in some cases, a lot of early cancers again start with cellular damage, and that damage also translates into DNA damage, right? And so again, if you can reduce that damage to the DNA and damage to the cells, repetitive sun exposure to the skin can put us at risk for skin cancers, right? So if this helps protect our skin, this helps reduce that oxidative stress on those cells, you're going to reduce that risk of that cancer in particular. Now, I'm not going to say all cancers, but most cancers have a similar mechanism of action. And if you can reduce that process, then absolutely you're making an impact on that risk and reduce that.
Good, good. Someone mentioned something about neurological disorders. I know when I was doing my research and what something that really caught my eye was the whole idea it helps people with dementia. That blew my mind. I don't understand that, but it really did blow my mind. Can you speak to that?
Absolutely. There's a whole subset of nutraceuticals called nootropics. Nootropics are nutraceuticals that help maintain cognitive function and improve that. There are a number of articles that talk about ergothioneine and reducing that stress on the neurological cells. One of the things they talk about is amyloid plaques and cisplatin. And if any guys you know about Alzheimer's, one of the key hallmarks of Alzheimer's is amyloid plaques in the brain. And so there's plenty of evidence that shows how ergothioneine helps reduce that amyloid production in neurological cells in the brain.
Man, I'm telling you, I'm getting, the more I talk to you, the more I listen to you, I'm getting very excited
You should be.
about
You
being,
should be.
I know, right? We're gonna be the only MLM company that's gonna be pushing this forward. And like you said earlier, John, like since this doesn't last in your system only for 30 days, we're gonna have those loyal customers that's really gonna be taking advantage of this process. And what I love about this is not only can this help someone who's in fitness, but this can help everybody, right?
Absolutely.
Both young and old can be taking our products and get the benefits from it. And I'm gonna tell you a story, right? So Chris sent me some samples of the product. Like he said earlier, I've been working with a couple of different clients, and he sent me some of the energy pills, right? And like I was reluctant to take the energy pills because I'm already working out, I'm in shape, I feel good, I'm good to go. So I said I don't need no extra energy. I go crazy in the gym or something like that. So I had the pill sitting there, and I was thinking about who was going to take this. And I kid you not, about midday, my wife came downstairs and she's like, baby, I'm tired today. Like, I cannot go on. I think I'm finna call it a day. And I'm looking at my clock, baby, it's only 1 o'clock. You about to go to bed this early? She said, I can't. I just got to go. And I looked over at the table. I said, oh, man, she could be my guinea pig right here. I said, honey, why don't you go ahead and try one of these pills? This is an energy pill. We're launching where you're worth it. We want to see if it has any effect, or you just give me your opinion about it, right? So she took the pill. And like any man, my memory just goes. I forgot that I even gave it to her. And I went back to doing my work and just minding my business. About 30 minutes later, she comes running up the stairs like, it works. I'm like, what works? What happened? Who did what? What works? She said, that pill you gave me, it actually works. And I kid you not, for the rest of the day, she was able to get all of her business stuff done, cook, clean, you name it. She was able to do it. And I was blown away. At that moment, from my perspective, I was sold. It helped my wife. She's very honest with me. I mean, she's very, very forthcoming and honest with me. And when she said it worked, I said, well, that's all you got. I'm so here. And like Chris said before too, as well, I have other people who's actually taking the product now, and the results have been amazing. I'm blown away as a trainer, someone who deals with this on a daily basis. I'm blown away by this product already. Like, well, I can't wait to take it.
And just to further support what you're saying, real quick, Chris, I'm willing to not only risk my 20-year practicing reputation on this product, but my company's name as well, and put this on the shelf right here. So hopefully that's meaningful to some of you guys. If I'm willing to do that, there's a lot to be said about putting my license, my name, and my company behind this product.
And John, that's a lot right there. I mean, that gets me even more excited about it. And I'm 100% looking forward to actually having this and taking it. I'm 41 years old right now. I'm like, what? This can slow down the aging process for me. I got to have it. Well, that's all the questions I have for you. Is there any other questions anybody else got that they want to ask John while we have him on the line today?
And John, I want to throw in real quick, and your research could probably highlight it even more. Somebody asked, should I take, not just the vitamin, but take some of the other products? Would that help me as far as MitoPrime goes? And I just want people to know the vitamin has our highest dose. That's 30 milligrams.
It does.
Other three range between 5 and 8 milligrams of MitoPrime, just depending on if you're talking about the tea, the sleep, or the energy. What I've been told is that up to 40 is about the most you want to take per day, to 40 to 45. So, taking all of our products obviously would take you right to, I hate to say perfection, and I will never advocate that every champion needs to, that's not what I'm saying. But, if you need to take one and only one, I would suggest the vitamin. If you want to take more, then you add what you want to add. But in no way will it harm you. It's only going to help you, just getting a little bit more MitoPrime in our system throughout the day. But I'm not going to tell people to take 3 vitamin packs every day so you have to order more often. Heck no, that's not integrity. So, but 40 to 45 is the recommended full dose. So you get there however you want to get there. But listen, I'm not trying to cut y'all off. I'm going to let it keep rolling. I just had to jump in to tell y'all, holy cow. I mean, people ask, can we put this in a lotion? Yes, we can. Will we? Just have to stay tuned, man. We're still 4 to 6 weeks from initial launch. So, you know, just wait and see what comes our way in the future and just realize what ground floor you're finding this company at. And listening to these two gentlemen tonight, I hope you're getting as juiced up as I am, because, secretly I've been taking this stuff for about a week. I take the energy, I take the vitamin, and I take the weight management, so that's what I've been doing. And the thing I have to tell you is, like, today was a rather hectic day. There was a lot going on, not only from doing 3-way phone calls to prospects, not only to reaching out to invite new people, not only to contacting the team, to tell people about this. I had my weekly Zoom with my founding four, and that went way over. So that was an hour and a half. I'm diabetic. I had problems with my insulin pump today, and that took a little extra time to get the new one working. So that caused a little bit, but nowhere did life get unmanageable. I mean, with all that going on, plus I had to get these guys on for tonight. I mean, it was a busy, busy day. And I haven't even told you the great news. Somebody asked earlier about what other ingredients are in here. We're going to share that with you real soon, because as of about 6 p.m. tonight, all of our products now have labels. Okay, we agreed on color, look, feel, everything about it. It's going through compliance, right? I mean, everything's being done the right way. It's going to take compliance a day or two to sign off on all the labels, the packaging, the way it all looks, that it's worded properly. Once we get that, you know what's on the back of every label, don't you? That's the list of ingredients. So don't worry, we're not going to hide it from you. We're not going to wait until you join and do your first order. No, we're going to start sharing that with you on Mondays, Wednesdays, and Fridays. Maybe not every night, but some of the times in between, so you guys can start to really get an upper hand on what's going on. Did they ever mention to you that it's good to be first in line? That's where you are right now. So with that, Jimmy and John, I'm going to turn this back over to you guys.
Yeah, a couple of things I want to touch on real quick. We talk about how powerful this product is, particularly in terms of its antioxidant abilities. One of the most powerful antioxidants that we know of in the human body is called glutathione, and that's in our slides. If you guys have been paying attention, they talk about glutathione, and all of the research shows that glutathione compared ounce for ounce to ergothioneine, it is as much as 30 times more powerful as an antioxidant as glutathione. So for you people who don't know what glutathione is, that's people pay hundreds of dollars to get glutathione injections on a monthly basis. And if you could share this ingredient with those people who love their glutathione, you've already got some built-in customers right there. But in addition to that, I always get a question about nutraceuticals about, is it FDA approved? And I don't know if you guys know or not if this is FDA approved, but let me tell you, it is not FDA approved. Okay, what the FDA says about this product, it's a I guess it's a label that they call GRAS, and it's, when you look, it's FDA GRAS, and GRAS stands for generally recognized as safe. Okay, that's an important thing. So when somebody gives you that, is this FDA approved question, you can say, well, no, it's not. However, they do consider it, generally safe for consumption. But you can also come back with, well, the FDA doesn't approve, water is not FDA approved. No vitamins are FDA approved. Okay. So it falls along the line of any nutraceutical which is not FDA approved. The European Society, again, says that it's safe there. It has an EFSA rating, which is European Food and Safety Authority. So keep that in mind as well as you're talking to people about this product. Um, but it is generally considered safe for human consumption. All kinds of other testing. When you look at the labels of this product, there are a number of labels that show all of the safety factors and testing and everything that's been done to allow this thing to be safe for human consumption. It's kosher. Um, we talked about good manufacturing process, non-GMO, gluten-free, all these things. So it has a number of labels to help support that this is completely safe and non-toxic for human consumption. So I just wanted to throw that out there as well.
I did have a good question came across the screen. Does this ingredient interfere with if you're on medications or that you know of, or
We again know of no interaction or adverse reaction or side effects known from L-arginine with any medication that's out there. If anything, it may create a synergistic effect to that medication. What I mean by that is it might make that medication a little more powerful. Take, for example, diabetes medications. It might, for example, if you're on a diabetes medication, it might help lower that blood glucose level a little bit lower than what you're used to. And if it does, you might feel that as a low blood sugar side effect. But to me, that's a good thing because maybe then we can reduce that diabetes medication or even come off of it with this naturally occurring supplement that we're going to be offering. Wouldn't you much rather take something that's a natural supplement than a pharmaceutical grade medication? And I think this is going to help people reduce the amount of medication that's required, particularly for diabetics and other disease processes that they're so dependent upon a pharmaceutical grade a product. The difference between nutraceutical and pharmaceutical is a pharmaceutical is engineered, in a lab for, it's synthetic, and a nutraceutical is natural. That's the nutra part of the word. So I think anybody would be a fan of taking something natural over something that's synthesized in a big pharmacy lab. So great question.
good. Anybody else have any other questions for John?
Surely there's more questions. We have 5 questions out of 56 people. Come on, guys, throw them out there. This is your chance. Or field it later. We'll field it later too, if you want to do that. Hopefully we answered most of those questions, but
someone asked when is the best time to take it, during the day or?
Well, I think the body would best be optimized with these nutraceuticals to be taken in the morning. Give your body what it needs to make it through the day. If you understand normal human physiology, our body resets itself at night when we're sleeping. That's when all of our chemical levels are restored to be fully optimized and get into that narrow therapeutic window. So taking it first thing in the morning to me would be best. Now, with that said, obviously the sleeping product is, obviously meant to be taken before you go to bed. A lot of people claim better sleep anytime they're on something that reduces inflammation. One of our biggest enemies for quality sleep is inflammation that's occurring, active inflammation that's going on in the body. So again, if you can settle down that inflammation, you're likely going to have a much better night's rest. Vitamin E, for example, is one of the body's natural anti-inflammatories, and people that take high doses of vitamin E at night often sleep better as well. So it's just a testament to how reducing inflammation can help you sleep better.
Good. Someone asked too as well, I'm reading the comments, hypothyroidism is, I don't know what that is, but
so hypothyroidism is an imbalance of your thyroid gland and its ability to produce enough thyroid hormone in your body. Thyroid hormone is one of the major influencers of your metabolism or your metabolic rate. It's also responsible for how healthy your hair and nails and skin is. Again, most of the disease processes involve some inflammatory response by the body in which it's not able to work efficiently. And so if you can again reduce that inflammatory response or optimize the cell's ability to do their jobs, you're going to reduce the chances of disease processes occurring. You're going to likely reduce the disease process that's currently ongoing. So, I haven't seen any studies out there that talk specifically about thyroid disease, but just simply understanding the simple cellular processes that occur, I would say it's very likely that someone would benefit from that.
Okay. If someone asks how about like blood thinner medication, or does it have any effect with that?
No known interaction with any blood thinners. There aren't a lot of different medications that can do that, but it does not, L-ergothioneine is not involved in the clotting cascade whatsoever. There should be zero effect from any blood thinning agents or medications that would interfere with that.
And if someone asks how about blood pressure?
If anything, it might improve blood pressure or it could lower your blood pressure further. Again, helping that blood pressure medication have a synergistic effect, you might need to reduce the amount of blood pressure medication you take. You'll have to, experiment with that on a trial basis and see how that makes you feel. It's hard to know, but again, um, this has so many benefits. It's hard to rule out any kind of health condition that can be improved because I think in all likelihood it can improve just about every medical condition that we run across, and at least in the common ones for sure.
All right, good, good. And someone asks, product age range, starting and the cutoff.
Good question. That's a point that I kind of forgot to talk about. One of the things about ergothioneine is as we age, as we get older, our body's ability to maintain that declines. And so for the elderly population or the aging population, this becomes even more important for us to be able to supplement ourselves with. A lot of things are like that. Nitric oxide, for example, is the molecule of life. And as we age, our body's ability to maintain and make nitric oxide declines. You know this from your trainer experience. And so getting ways to optimize our nitric oxide become more important as well. Our hormone levels do the same thing, thyroid being one of those hormone levels. So our body becomes inefficient as we age because of the oxidative processes and oxidative stresses and damage that those free radicals cause. So again, this is going to help eliminate and reduce that oxidative stress and those free radicals in the body, which are going to help improve essentially every cellular process that we have going on.
Okay, this is, man, I'm getting excited. The longer I talk about this, the more excited I'm getting. I have learned so much by just talking to you. We got some more questions coming in though.
Yeah.
If someone asks, will it help with Crohn's disease?
Crohn's is often an inflammatory reaction in the gut lining, small intestine, bowels. So again, a lot of the GMO products, a lot of the products out there that are super processed, they're going to aggravate our intestinal lining. And Crohn's is a multifactorial process. But again, this isn't like a probiotic, but again, reducing that stress on the cellular level, I would say try it and see if it helps you. Again, we can't make any claims, but Crohn's is a difficult disease to have to live with. And if it improves their, quality of life by 25%, to me, that's worth it. You are worth it. So I would say have that individual try the product for 30 days and see what they notice. This certainly isn't going to make it any worse, but if it can improve things, by all means, let's give it a try. Let me address one of the questions here. When talking with a medical professional, what are the main points to highlight? Well, there are many points that you can highlight. I would try to focus in again on that inflammatory response and reducing the oxidative processes that occur in all of the disease processes. if you're trying to get like a medical professional to maybe carry this product or get them on board, I think those are the areas you would focus in on, emphasizing that this particular ingredient, L-arginine, is such a powerful antioxidant and such a powerful anti-inflammatory. Those 2 points alone are what 90% of the medical professionals out there deal with. So if you can, impact their patient profile, their patient population with just those 2 things, they're going to go out of business probably if you were to eliminate that altogether.
Man, it sounds good to me. We have a really good question.
We got to be careful not to cure the whole world all at once,
I
but we certainly want to make an impact, right?
Exactly. But someone asked, my friend's daughter has trouble sleeping. Can a 4-year-old take the sleep aid?
You got to be careful with the youngsters on that. I don't know. I haven't read any science about how that might amplify things in a child. What I would say is, reduce everything to half dosing, just like you would if they were taking an aspirin or a Tylenol or something like that. A children's dose is generally the same medication, but a much lower dose. So try them on a half dose or a quarter dose of the product and see how they respond. Again, there should be no adverse reaction or side effect to this because, again, it's already naturally occurring in their body. They probably have more of it than you do. But to say that they couldn't benefit from this is, I think, hard to say. I think they probably would benefit. But again, I would just, try to find smaller dosing regimens for a child and test them on a daily basis and check that out for yourself. So no true guidance from you on that. I haven't heard anything negative about children taking this product. From everything I've seen and read, I would say it's probably safe to take from 4 to 94, modifying that dose, if you feel that that would be necessary. One of the other questions here, if this lasts 30 days in the system, does it continue to compound as you take it daily? In other words, if that dose continues to go up and up and up, you're going to reach a peak level at some point. Anytime you talk about an ingredient or a medication in the body, you're talking about the half-life of that ingredient. In other words, how long does it last before half of it is gone? And if this lasts 30 days, you're going to reach some maximum level of ergothioneine in the body. Again, the recommended dose is 30 to 40 milligrams in a day. I haven't seen a lot of research that talks about dosing yet out there. I'm sure there is some things, but that's part of what NNB does. I believe they also make recommendations on proper dosing for this. So yes, it would compound to some effect. You'll reach a maximum level in the body, but it's not going to continue to compound and compound like heavy metals would, for example, if you become iron toxic or lead poisoning or that type of thing. So I would say no to that answer. It's not going to continue to compound.
All right, good. So here's the last question. This person asked it twice. With migraines, would this help with migraines?
Gosh, hang on. I lost my Zoom. There you go. Great question. I haven't read anything again on those particular studies for migraines. Generally, a migraine is triggered by a variety of things, but dilation of the blood vessels around the brain and scalp that cause an immense amount of pain. So oftentimes the body dilates those vessels due to some response, some inflammatory response oftentimes. So I wouldn't recommend it as a headache medication per se. I don't have a lot of information really that I've run across that I can truly answer that question 100% confidently.
Okay. Well, man, John, my mind is blown, right? I appreciate you coming on, answering all these questions. I try my best to write some of this stuff down that I can present to the people. I know it's just too much, but I just appreciate it. And it seems like we have our hands on some gold here. I appreciate you coming on and sharing all your knowledge with us, man. This is very informative.
Before you guys go, I got a question for each of you.
Yeah.
and Mr. Lacey, I don't want you to give any detail, but you're working with 4 people that are taking the weight management tea and following a very simple regimen. Because I've spoken to them, they said I don't have to be a rocket scientist to follow all this, but are you seeing good, positive results? I know you've only been working with them for like 8 days or 9 days, but are you seeing some good results?
You know what? As a trainer, like since I have my own brand, U Shape You Fitness, and like I'm very particular of what I recommend. Right? I'm very skeptical of when someone try to offer me vitamins or whatever it may be. But man, my mind is blown about this. I'm seeing the results like I'm confused about the results. That's how good they have been on a daily basis of what being communicated back to me, that my mind is blown. I mean, at the end of the day, it's going to be, you know, their testimonies, their stories. And I'm asking these people, asking these clients, and they've been honest with me. And my mind is blown. I don't, you know, this is just the beginning. My brain is still trying to process all of this. But as of right now, my mind is blown, and I'm just amazed with the results. Just right now, there's only been like a week or so that they've been on the product. So what more can I say? As a trainer, I'm happy that they're getting the results that they've been searching and looking for. And this is being able to assist them with that.
All right, I can't wait. I can't wait to hear all about it as they start to fulfill their time with you. So John, this is going to roll me into my final question to you. So I want you to get ready, man. It's going to be like, this is the lightning round, right? So here we go. There's a gentleman on here. His name is Chris. Great name, by the way. And throughout tonight, he asked a few of the questions that Jimmy was reading off to you. Does it help if I have this? Does it help? That's not me, Chris, by the way. That's a different Chris. He was asking, does it help if I have this problem, if I have this disease, if I have this? And I'm sitting here thinking, man, he knows a lot of sick people, right? But here was his final comment. It said, God is good that he brought this product to all of us. So with that said, John, you started off tonight and you ran through it pretty quick. I want you to take 30 seconds and go back to the beginning of tonight's Zoom. And Jimmy asked you, what are the benefits of MitoPrime? And you said, boom, 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 boom.
Yep. So that was one of the last questions I was reading here. And just not to leave Belinda out again, is this recommended for children with autoimmune diseases? I am not a pediatrician. I am not an autoimmune disease specialist. But again, most autoimmune diseases start from some inflammatory process that's going on, not understanding for sure what that particular child has. But I would say, again, very, very possible that this child could benefit from this product. So I'll leave that one alone and just leave it with that. But again, to recap the list of benefits, we talked again over and over again about the antioxidant ability of this. So it combats oxidative stress. It protects our DNA and our genomic material. It protects our mitochondria, which is what generates our energy in the form of ATP. It increases energy and stamina, reduces cellular inflammation. Guys, inflammation and antioxidant is all you really need to worry about with this product. If you can't remember anything else, remember that it's a phenomenal anti-inflammatory and it's a phenomenal antioxidant. Boosts our immune system, detoxifies the cells, and protects the skin. What more do you guys need? I mean, I could throw a couple more things on the list, but this is enough. You know?
All we need now is money, and that's going to start flowing in March. Stay tuned as we keep creeping a little bit closer and a little bit closer to being able to announce the launch date to you. I promise you it's coming fast and heavy. We are working tirelessly behind the scenes to make everything happen. Folks, you just wouldn't believe what goes on in a daily basis. Have more updates coming to you this week. Hey, don't forget, we have our presentation again tomorrow night, 7 p.m. Central. Load up the lines. You got the information tonight from these two guys that, I don't know, it blew me away. I learned more tonight than I've learned so far. So I'm going to take this information, I'm going to turn it in to a massive growth experience. I hope you guys all do the same. Can't wait to see you and your guests tomorrow night. Mr. John Bargerstock, Mr. Jimmy Lacey, thank you so much. I can't, in case you guys wanted in on a little secret, when we do launch, there's going to be some training videos, and those two gentlemen, they're going to be part of the videos. God bless you all. Have a massively great night.
Thanks for having us on, Chris. Appreciate it.
Appreciate it. Appreciate it.